We are just days away from October, which is Breast Cancer Awareness Month. October serves every year as a reminder to increase awareness of the disease. The Centers for Disease Control and Prevention says each year in the United States, about 250,000 cases of breast cancer are diagnosed in women and about 2,300 in men. About 42,000 women and 500 men in the U.S. will die each year from the disease. For more on this, I want to bring in Nancy Brinker. She is the founder of the Susan G. Komen Foundation and the founder of the Promise Fund of Florida. Welcome, Nancy. So great to have you with us.
Thank you.
So, Nancy, how have we seen the coronavirus pandemic impact those with breast cancer and the industry itself?
Well, there's been a great deal of impact. First of all, so many people have avoided their screenings, have not been in to see how they are. And people generally need a mammogram who are of age over 40 to about 65, sometimes 70, at least every 2 years. And when you don't keep up with screening, you can develop early disease, which can progress, especially in younger women, and be very deadly. The survival rate of very early breast cancer can be 98%. When it progresses to a later stage, it goes to about 27%.
And because of the coronavirus pandemic, by June 30th, the CDC reported an estimated 41% of U.S. adults, as you mentioned, had delayed or avoided medical care. So We're seeing this with mammograms, as you mentioned. Are we then also seeing this impact breast cancer treatment, those needed treatments?
Well, of course. And remember that the people that are always hit the hardest are people with disparities, people who don't have access to care or do, and things are very slowed up because of other social determinants like travel to an appointment or communications or language barriers. And so we at the Promise Fund of Florida, which is a new organization I started a few years ago to deal with disparities with women in breast and cervical cancer, are seeing this very frequently where women are avoiding screenings because they're nervous. On the other hand, they can't get there. So we have provided a very adequate way for them to get there. We have a relationship with Uber Health, and they will take the patients back and forth to the clinic.
Right. Let's talk more about the group you founded, the Promise Fund of Florida.
Right.
As you said, it's a nonprofit focused on eliminating those disparities in care. Why did you choose to start this organization, and why in Florida specifically?
Well, Florida's my home. And when I got done with my government service, which was about 10 years in length, all told, and also the 35 years that I had put in building Susan G. Komen, I realized we weren't making the kind of progress we should be making in treating people, bringing them into the healthcare system who have disparities. So we're working on a lot of issues to get that happen. First of all, community awareness. We have navigators from the communities in which they live. In this case, in Palm Beach County, which is the third largest county in Florida, which is now the third largest state, is another reason why I embrace this so much, because we found out that Florida alone is 49 out of 50 states in terms of healthcare delivery to women. And we need to even that out. We need to make sure we make progress in this. And it costs so much less for the patient and for our healthcare system to be able to diagnose people of low resource so we can get them back to a normal, healthy life for their families and for the work they do.
And then, as we've been saying, we're just about a week away from Breast Cancer Awareness Month. So what do you want to leave people with? What do you want them to know as we approach October?
I want them to know that in most cases, breast and cervical cancer are curable in their earliest states if they're screened and detected early. And it means everyone has to make an effort. You know, all healthcare, like politics, all healthcare is local. And we have to have the system set up locally. We can't just depend on the federal government. We can't depend on the state government. But we do need to depend on ourselves and the communities to build the kind of programs, actually hands-on, that get people where they need to be screened, to be diagnosed, to be treated. It's not that hard. And with the Promise Fund, we've set up a really good system of screening. And now we're well at work in setting up a system called Continuum of Care, where we will move patients through a rather seamless system, we hope, so that we can return them to the best health they can be in and the best outcomes.
So much starts at the community level. It sounds like you need to
Yes.
replicate the Promise Fund in all 50
Right.
states.
Yes, we're getting a lot of
Nancy,
people interested.
well, Nancy Brinker, thank you so much for joining us. We really appreciate it.
Thank you very much.